Rural healthcare in Missouri is in a crisis. Smaller communities don't have the resources they need, and it's threatening people's health. Good evening to you. I'm Noah Klein. Thank you so much for joining us. Tonight we're starting with the first installment of 2500 Below. It's a series of stories and images looking at the challenges and successes that are changing Missouri's small rural towns. KOMU8's Sarah Moyers leads us off after visiting Versailles. She shows us why providers there say rural healthcare needs a lifeline.
We just need more healthcare providers across the board.
Across the board and across the state. From a lack of doctors and specialists to hospitals, rural communities in Missouri need more.
Access is one of the biggest problems, and it's everywhere from primary care all the way up through specialty and hospital care.
According to the Missouri Department of Health and Senior Services, 99 out of Missouri's 114 counties are rural. As of 2020, a report from the National Institutes of Health says 56% of Missouri counties don't have a hospital. In places like Versailles, the closest hospital is 45 minutes to an hour away.
If somebody comes into my hospital, the array of what we can do for them is not as exorbitant as some of the bigger places.
But having facilities that can do more is just half the battle. Rural communities have a hard time recruiting doctors and keeping them there.
One way to increase, the likelihood that doctors will go back and train or go back and practice in a rural place is either to be from a rural place or to do some part or as many parts of their training in a rural location as possible.
The Association of American Medical Colleges found nearly half of those who completed their residency program in Missouri in 2021 are now practicing physicians in another state.
There's also no guarantee that the doctors that they train will actually stay where they're trained, although that is definitely one of the goals.
MU's School of Medicine has a rural pipeline program aimed to admit more people from small towns to medical school.
If all we do are admit kids from big cities and privileged backgrounds who qualify because they have high test scores, and then we expect that somehow those folks are going to turn into small town doctors, they're not.
But Morris says federal funding is a barrier to starting more of these programs. And without more funding, many rural healthcare facilities can't afford training programs.
They can't keep people employed. They can't keep the lights on. They're not getting reimbursed enough. All of that is like deeply rooted into some of the flaws of the American health system just in general.
Expanding medical care in Missouri is something many healthcare providers say is vital.
That's what our community needs. Our community deserves that.
To help rural communities survive. Sarah Moyers, KOMU8 News, Versailles.
This upcoming school year, MU's School of Medicine is starting the first rural residency program in the state. It'll send 2 family medicine doctors in training from each class to a clinic in Sedalia.